Very good. So the buzz is subsiding. So very pleased. And I want to thank, again, Andy Weber, and particularly the members of your panel for getting us off to such an excellent start in terms of that presentation, the discussion that you had on the business case for why business should get involved. So I'd like to remind you all that once again that the workshop's being recorded as well as webcast, and so be aware of that. So with the second panel in place, we have it moderated by Kathy Baase from Dow Chemical, who's already been introduced, and I'm just absolutely pleased that she's taken on the task of moderating this panel. So, Kathy.
Hello again. Thrilled to be here. If you haven't already captured this piece, the day is organized to move us through from an example of some really amazing work being done by, in fact, a private sector company, Blue Zones, working and engaging all sectors in their work. So we've got our keynote. Then we started with the case for engagement. Now we're going to move on to what would the business community do? And we have two panels that are going to focus on that from a very different lens. And then we'll move into the final panel, which is going to be on how we do that kind of work. Now, addressing the focus of what would the business community do, we can think of such a broad landscape. Sometimes they're going to be working, which people have already recognized for a long time. They're going to do this health promotion work in terms of their own employees. We're talking about the bigger picture of the community, but even how they get involved in the community or what they might do is very broad. I just spoke briefly about philanthropy, advocacy, direct involvement in health, sometimes involvement in social determinants factors, sometimes involvement in their own choices about their business products and services. There's been a lot of buzz this past year about CVS and their choice not to sell tobacco products. So the landscape of what a business might do or an employer might do is broad, and we want to feature that with these different elements of the panel. So this panel is going to start off by illustrating activities where businesses are taking action driven by their own priorities that are having a positive and beneficial impact on population health, even if that wasn't the driver that started. So maybe it's an education initiative or something like that we know is making a difference to the overall health of the population, but they may not have even characterized it as a health priority or a health project. So this is to bring us back to, again, early adopters oftentimes who are doing things, and this beginning recognition of the interdependency of the business to their community and how those things can be illustrated. We're going to have this panel speakers similar to the last. We'll have all speakers finish their 10-minute sessions first, and then we'll open up for questions. So please hold your questions till they're finished. And we'd like to start with our first presenter, Gary Roast, an Executive Director of the Savannah Business Group. Gary?